evening, one and all. On behalf of Endocrine Society of India, I welcome you all to yet another enriching session of endocrine awareness. Those who have been following us well know that this is the month for bone health awareness. And since October 20 is observed as World Osteoporosis Day, so our topic for today's discussion is osteoporosis myths and facts. So for today's discussion, we are privileged to have with us subject experts from all over the country. To name them, first of all, I would like to welcome Dr. Ambrish Mittal, sir. Sir is the chairman of Pan Max Healthcare, New Delhi, as well as sir is the president of AIMS Gorakhpur. A very good evening, sir, and I welcome you for today's discussion. Second, I would like to welcome Dr. Rana Bhattacharjee. Sir is assistant professor in Department of Endocrinology at IPGMER, Kolkata. Welcome, sir. A very good evening to you.
Thank you. Thank you.
Then we have with us Dr. Sahana Shetty. Ma'am is Professor and Head of Department of Endocrinology at KMC Manipal. Good evening, ma'am. Next we have Dr. Deep Datta sir. Sir is a Senior Consultant Endocrinologist at Cedar Super Specialty Healthcare, New Delhi. Welcome, sir. A very good evening to all our panelists. So before we begin our discussion, I would like to request Ambrish Mittal sir to please throw some light for general public about osteoporosis before we discuss the common myths and facts. So please let us know some common things about osteoporosis, especially why should people be concerned about it?
Thank you, Endocrine Society and all my young friends for inviting me here. I think it's important that we first realize why are we talking about osteoporosis? Why osteoporosis? Why not something else? Not just because it's a bone health month, but for a disease to be of importance to the general public, there are three criteria it should fulfill. One is it should be common. Right? It should be common. Very rare diseases, you don't want so much public awareness. That's a different genre, a different niche altogether. Is osteoporosis common? Yes. 1 in 3 women in their lifetime will get a fracture because of osteoporosis. 1 in 5 men in their lifetime will get a fracture because of osteoporosis. So it's a common condition, right? The second thing is it should be serious. So common cold is common. We don't have seminars on common cold. We had plenty on COVID, so why? Is osteoporosis serious? Who cares, one fracture or the other? We know that hip fracture, which is the most devastating consequence of osteoporosis, in our own country also, people, elderly, think of people in your family, elderly people who had a hip fracture. Your grandmother, your mother, anybody who had a hip fracture, the 1 year survival rates, 1 year mortality rates are between 20 to 30%, which means that 20 to 30% of those who get a hip fracture, and they are mostly elderly, above 75, 80, they don't survive beyond a year, because of various things that happen when you're bedridden because of a fracture. So it is serious, right? So it's a serious condition. So if you prevented that fracture, you would probably save that person for many years, right? So it's common, it's serious, and third is we should be able to do something about it. Can we do anything? It's okay to talk about a disease that's common and that's serious, but kuch kar nahi sakte. So the thing is, in osteoporosis, both in terms of prevention and in terms of treatment, there are huge number of modalities available, very effective, powerful ways to prevent our skeleton from deteriorating. And at the same time, if we do reach that stage, then really good treatments, effective treatments are available to us. So these are the three reasons why we should worry about osteoporosis. And just before I hand over the mic back to you, I think it's important again to define what is osteoporosis. When we say we're talking of osteoporosis, people think of different things. Someone thinks of osteoarthritis, someone thinks of, people think of all kinds of different things. Osteoporosis means porous bones. Porous bones means that a bone that is less strong or weaker or fragile as compared to a normal bone. So therefore, such bones would tend to fracture even with minor or no trauma sometimes. So you could be sneezing or coughing and break a bone if you have osteoporosis. So it is common, it's widely prevalent, it's a community problem. It can have serious consequences, and we have plenty of good things to do to prevent and treat osteoporosis. And as the Indian population is aging, and more people are living longer, big thanks to our cardiologists and our improved healthcare, then we get, and more are urbanizing and going indoors, and we'll come to all that, reducing physical activity, then our risk of osteoporosis is also increasing. So India is now very much on the world osteoporosis map. Unfortunately, unless we take steps, we will continue to advance on that scale. I hand the mic back to you.
Rightly said, sir. Osteoporosis is a disease which is fairly common, and we can cure it as well as prevent it. So, sir, the patients, when we ask them to get screened for osteoporosis, people are like, osteoporosis is normal. Your bones get weak as we age. So, is it true that osteoporosis is a part of normal aging and it should affect all the elderly?
So, okay, so there is yes and no to that question. Number one, it is true that we all start losing bone after the age of 40. Some people say 35, right? So we are losing bone every day. We build we build our bone bank till the age of 30. Some say in Indians it goes up to 35. But the fact is that after that, we maintain for some time and then we start losing bone. That is normal aging, right? And therefore, with that aging, at some point, it is thought that everyone should reach a stage when they reach a diagnosis of osteoporosis and fragility fracture. So that is correct. So it's like graying of hair, enlargement of prostate, blocking of atherosclerosis in the arteries. But is it inevitable as a disease? No, it is not inevitable as a disease, because this whole process of bone loss can be reduced, attenuated very substantially. So it depends on the slope in which you are. So if you're losing bone rapidly, you'll quickly reach a stage of fracture risk being very high. If you're losing bone slowly, you will reach that stage much later. Therefore, how do we find that out? There are no symptoms, right? And of course, I haven't talked about peak bone mass, which also depends on how well you build your bone during growth, during adolescence. So when you achieve that peak bone mass and then you lose it, it depends on the rate at which you lose. That will determine your osteoporosis. Now, why should we worry about it? We've already discussed why should we screen? Why should we screen? And a simple answer to that, which people might understand, is why should we check our cholesterol level? Why should we even check our blood glucose level? Why? Because we know that although there are no symptoms, people with diabetes, people with high cholesterol are prone to complications. So, hypertension patients are prone to stroke. Why check for blood pressure? People have no symptoms. People with high cholesterol are prone to heart attacks, but they have no symptoms of high cholesterol. So, why check for high cholesterol? So, you know, treating these conditions after the event has happened is like, bolting the door after the horse has bolted, right? So, but still, of course, you will treat at that point. But the key point is to prevent the first fracture. So those who are vulnerable, if they get a bone density done, which has a similar, as I said, an analogy to hypertension or cholesterol measurement or even blood glucose measurement, right? Because all these conditions are asymptomatic. So there is no symptom in early osteoporosis or moderate osteoporosis, sometimes even advanced osteoporosis. So unless you do a bone density, you will only find out when a fracture happens. So you don't want to wait for the fracture. You don't want to wait for an MI to happen, a heart attack to happen in somebody who has high cholesterol. You want to prevent that, right? So that is the reason why we should screen. And who will screen, I'm sure will be discussed. But definitely postmenopausal women above 60, men above 65, all of them require screening. Screening means ideally getting a bone density measurement done by dual energy X-ray, DXA, right? So that is why screening people without symptoms should get their test done if they want to avoid fractures in the long term.
Right. Thank you, sir. So definitely osteoporosis is a part of aging, but then it is a disease. It may not affect everyone. And since it is a symptomless condition, it is good if we get it screened because we can prevent it as well as we can cure it. Why wait for a fracture? So my next question is for Rana sir. So people who are aware about osteoporosis, they have this conception in their mind that lack of estrogen causes osteoporosis. ये तो केवल females की बीमारी होती है, वो भी after menopause. How far is that true?
Absolutely. Again, it's partially true because, women after menopause are most prone to osteoporosis and fracture. And as Dr. Mittal has said, that 1 in 3 women, that's a huge number, uh, usually suffers from fracture after menopause. But there are men also suffer from fracture after the age of 50, and that number is also quite huge. 1 in 5 men actually suffer from fracture after age 50. But that's not all. Even younger individuals, like those who are even younger than 50, both men and women, women before menopause even, they can have osteoporosis and fracture because usually secondary to many other diseases or some medications or something else. Just to give some common examples, a disease like excess of thyroid hormone, like excess of glucocorticoid in the body, we call it Cushing syndrome, or disease like rheumatoid arthritis, which is one of the pain and stiffness of the joints. It's a very common disease. Some use of some drugs like some steroids or drugs for epilepsy for a long period, some diseases of absorption of food, all those things can increase the risk of fracture in younger individual as well. As I remember, just a few days back, one young man of aged just 27 came to us with 2 fractures in the last year, and some of the relatives referred to us saying that there may be some of the problem related to hormone. And yes, there was osteoporosis, and he was investigated and found to have he was harboring a disease of a gland called parathyroid gland, where there is increased risk of fracture, and there is a tumor in that gland, and that was removed, and the patient was apparently cured. So it's very important to know, yes, it's a very common disease in a postmenopausal age group, but older men, even younger men and women are not spared of this condition. So we have to be aware of the situation where the osteoporosis is common or the risk is high.
Thank you, sir. So osteoporosis definitely affects postmenopausal women more common, but then it can also affect men as well as younger men and women. So moving on, Deep sir, uh, it is very difficult to convince the patients that they can have osteoporosis. It is a common myth that they think that they don't have any bone pains, they have never had any weakness, they have never had any backache or a fracture. So why would I have osteoporosis? Why should I get screened for? This is a common concern that we face in our clinical practice. So I would like you to tell people that this how far is this correct that they cannot have osteoporosis if they don't have any bone pain or if they don't have any fracture.
Absolutely, yeah. So Dr. Mittal and Dr. Bhattacharya have beautifully summarized the burden of the problem and what are the clinical conditions in the society which can lead to bone loss. We must realize that all individuals they achieve a peak bone mass around 30 years of age. After that, we all lose around 1 to sometimes even 2% of our bone mass annually. There's a decrement, there's the loss of bone mass. And people who work out less, those who exercise less, those who have sedentary lifestyle, and those who tend to lose more muscle mass, they also tend to lose a greater amount of bone mass. So we all lose bone with age. Some people lose faster. There are certain disease states which Dr. Bhattacharya just told us, which makes us lose bone faster. And the point is here we are trying to prevent something. If I get a fracture, then whatever I do, the improvement in outcomes will never be as good as if we could prevent that fracture. So screening of osteoporosis is all about preventing fractures in an asymptomatic individual, and hence all the guidelines they recommend screening for bone mineral density, that is screening for osteoporosis in all women more than 65 years of age. We deserve a screening. All men more than 70 years of age deserve a screening. And if I have one or more risk factors, like if a lady has premature menopause, if I am exposed to medications which causes bone mineral loss, like if I am taking steroids for different medical conditions, if I am a cancer survivor, I've been exposed to anti-cancer medications. Some of them are known to cause bone loss. So if I have medical history which predisposes me to bone loss, then I deserve a bone mineral density screening at my spine and hip at least, wrist joint optional, spine and hip at least, because we want to prevent the hip fractures, as Mittal sir just told us, because it's a highly lethal condition. Its lethality is much more than even cardiovascular events or cancer. So it's totally wrong to say that if I don't have bone pains, yeah, if I'm totally asymptomatic, I cannot have osteoporosis. It's not so. We Indians, we have thrifty phenotype. We have greater fat mass. We have lesser muscle mass as compared to Caucasians or Afro Americans. That also predisposes us to osteoporosis. With the increased prevalence of diabetes pandemic, and in Indian society who have a greater systemic inflammation, greater insulin resistance, that also sometimes cause accelerated bone mineral loss, especially in people with uncontrolled diabetes. It's a big problem.
Thank you, sir. So definitely one should, get screened for osteoporosis if your endocrinologist recommends you, because you may not have a fracture, you may not have any symptoms. It is a silent disease. So moving on, Sahana ma'am, uh, patients do believe, but then even physicians and many other general practitioners believe that osteoporosis is to be screened when there's a fracture. So people are just aware that fracture is a symptom of osteoporosis. What are the other clinical signs or symptoms that patients should be aware, and they should be, that we should go and get screened for osteoporosis? Apart from a fracture, what other clinical signs and symptoms should patients look for?
That like we discussed by Abhishmita sir, Dr. Rana, and Dr. Deep, it's a silent disease. So most of the patients do not have symptoms, and the first presentation is often with a fracture. And however, some of the other symptoms we could be seeing is in patients with vertebral fractures. Of course, if they have an acute vertebral fractures, they could present with back pain and acute back pain. But sometimes the other symptoms is that we often see this elderly woman having stoop posture or a hunchback, or family complaining that there's a progressive curvature, progressive worsening of the curvature of the spine. And most of these women would thought this as a process of aging and would have not have received treatment. This is actually a symptom of a prevalent vertebral fracture, or an a vertebral fracture which is present and just making the curvature of the spine in that way. Then some of the women would lose height. So these are the two symptoms of vertebral fractures which patients might have and which suggest of underlying osteoporosis. But otherwise, in general, osteoporosis is an asymptomatic disease, and it is usually the fracture which brings one to the clinical attention. So, as mentioned by everybody, it is very, very important to screen the at-risk population and risk stratify them, so that you identify the diagnosis of osteoporosis at appropriate time. And then we have medications which could reduce the risk of fracture by more than 50%. So, and that's huge. So, it's very, very important that we know that it's a disease which is asymptomatic. Of course, you could have some symptoms like loss of height and a stoop posture or a hunchback, which could suggest of an already existing vertebral fractures, but otherwise it usually presents with fractures. So active screening is very, very important.
Thank you, ma'am. Mittal sir, I had a yoga trainer coming to me, and she had a history of premature menopause, and she suffered a low trauma fracture. When I tried to convince her for screening for osteoporosis, she was like, I have been doing yoga for the whole of my life. How can I have osteoporosis? So, sir, can you please enlighten us about this connection between doing yoga and exercise and getting osteoporosis?
So I think she's right to some extent. Those who exercise regularly are less prone to osteoporosis, but they are certainly not immune to it, right? So in fact, let me tell you, one end of the spectrum is elite athletes. Elite athletes who are running regularly, and marathon runners, and very lean and very fit. They sometimes actually get lack of estrogen, and they may actually have problems with their menses and may be more prone to osteoporosis. But that's one extreme group. What your friend is asking is something different. Is something that someone who's otherwise healthy, otherwise well preserved. Yes, You reduce your chances of osteoporosis considerably by exercise, especially not just of the bone density in osteoporosis, but of fractures because of osteoporosis. How does that happen? When you do exercise in the erect posture, when you're erect and exercising, aerobic exercise, even if it's brisk walking, but it may be more intense aerobic exercise, maybe you're playing badminton, maybe you're playing tennis, whatever. If you're doing that, then the lines of stress, the weight bearing lines go through your bones. And that is the best stimulus for bone regeneration. See, bone in our body is constantly being lost and constantly being built. So a stimulus for bone building is when the lines of weight bearing lines, the lines of stress go through our bones. So number one, any exercise done in vertical posture reduces the risk of osteoporosis. The second is that any exercise which helps us build our muscle, improves our balance, like yoga or Tai Chi, as they do, all those exercises which improve balance will reduce the risk of falls. Reducing the risk of falls will also reduce the risk of fractures. So I think it's important that we realize the other aspect. There is crosstalk between bone and muscle. So if muscles are building, bones also improve and vice versa. But in a very simple way, I would say that by exercising regularly, you are reducing your risk of fracture. However, genetics, nutrition, other concomitant conditions, any other disease you may have, all those things, they can also make a difference. So it does not make you immune to osteoporotic fracture, but it does reduce your risk.
Thank you, sir. So we well know now that regular exercise and yoga has a strong impact on your muscular as well as your bone health. But you cannot deny that you cannot have osteoporosis if you exercise regularly. There can be certain other medical conditions which can predispose you for the same.
So just a point about resistance training. It's important that, like we are not talking for diabetes, but for bone health, we've been talking for a long time that, if you throw in resistance training even 2 days a week, which means light weights, this, that, there are methods to do that which are safe at any age, then you will prevent bone loss significantly, muscle loss significantly. Indians tend to be sarcopenic, as Dr. Datta was saying. Indians tend to be sarcopenic, we tend to have lower muscle mass, and therefore we tend to have, greater falls and all this. So it is important to preserve muscle at all costs. Thank you.
Thank you, sir. Moving on, Rana, sir, everybody knows that taking calcium and vitamin D regularly will prevent you from osteoporosis. So I would like you to enlighten us about this thing, how calcium and vitamin D are connected with our bone health and to prevention of osteoporosis as well.
Right. As properly said, that calcium definitely we all know is a building block for our bones, and regular intake of adequate calcium definitely helps to prevent osteoporosis. It makes bones stronger. That is something everybody knows. But the problem is that the calcium content of our diet may not be adequate for many of us. Just to give an example, we need approximately around 1000 to 1200 grams of calcium per day for our bone health, to maintain our bone health properly. But milk, which is possibly one of the richest source of calcium in our diet, that one glass of milk just provide around 300 to 350 milligrams of calcium. And many of us are intolerant to milk. So here lies the problem. Individuals who cannot tolerate milk, they need to get it from other food sources like nuts, like green leafy vegetables, and other sources. But again, many of them need supplemental calcium as well to make up for the lack of calcium that are in the diet. Vitamin D is a very, very important hormone which basically helps in absorption of calcium from the foodstuff. And unfortunately, in India, it has been shown that around 70 to 80% of the general population lacks adequate vitamin D. Again, that makes a person more prone to fracture. So again, the adequate vitamin D level can be maintained by sun exposure, but that's very difficult practically for many of us who mostly work indoors. So again, there may be a need for supplementation of vitamin D as well. So, the source of calcium, if it is not adequate from our diet, can be supplemented by calcium tablets. Similarly, if the vitamin D level is not adequate, sun exposure is not adequate, supplements can be given. And there is an ongoing talk about the fortification of oil and milk with vitamin D, which definitely will help in the future. That's there in other countries as well. So these are two very important elements for bone health. Definitely.
So just to add on, लोगों का सोचना है कि हम सुबह सुबह रोज धूप में बैठते हैं, तो does that सुबह सुबह की धूप help in formation of vitamin D or not?
No, not really. You need a much stronger kind of sun exposure, like somewhere between 10 a.m. to 3 p.m. would be ideal. But in the summertime, and as I've said, those who work indoor, is very difficult to expose adequate body parts to this amount of midday sun. So that's not practical for many of us. So many of us actually truly need supplementation of vitamin D.
Thank you, sir. My next question is for Deep, sir. लोग ऐसा कहते हैं कि अगर एक बार बोन कमजोर हो गई तो अब कर क्या सकते हैं? वंस आई हैव गॉट ऑस्टियोपोरोसिस, व्हाट कैन बी डन? दोबारा और कैसे बोन बना सकते हैं? सो कैन यू प्लीज टेल अस दैट वंस डायग्नोस्ड विद ऑस्टियोपोरोसिस व्हाट ऑल कैन बी डन?
नहीं, ऐसा बिल्कुल नहीं है. It is not the end of the world. So Mittal started with a very positive input that yes, it can be treatable. We can prevent fractures. So अगर मुझे osteoporosis पकड़ में आती है, DEXA scan में my bone density is low, then we can do it. We can try to find a cause. So if I have underlying cause like underlying untreated hyperthyroidism, if I correct the underlying cause, it will improve my bone mineral density. If I have a tumor in the neck of the parathyroid gland, if I surgically get the tumor removed, it is a remarkable improvement in bone density in the first year. It's amazing improvement in DEXA scan scores after 1 year. If I don't have any cause, अगर किसी को premature menopause होके रखा है, अगर कोई किसी in a male individual andropause हो चुका है जल्दी, testosterone level बहुत कम है, if you correct the hormone deficiencies, that has a beneficial impact. अगर कोई कारण नहीं मिले, सबसे प्रमुख कारण है if there is a deficiency of vitamin D and calcium, just by giving simple calcium supplements, ensuring that my vitamin D levels are more than 20 nanograms per ml. तो कितना होना चाहिए? For bone health के लिए more than 20 nanograms per ml of circulating levels of vitamin D is considered good enough. For non-bone mineral effects कहा जाता है कि more than 30 nanograms per ml vitamin D. One important message मैं देना चाहूँगा कि vitamin D मतलब कोलिकैल्सिफेरॉल होता है, कैल्सिट्रायल नहीं. जो महंगी कैल्शियम की टैबलेट्स होती है उसमें कैल्सिट्रायल होती है, जो कि एक बहुत पोटेंट, बहुत स्ट्रॉन्ग एक्टिव प्रिपरेशन ऑफ विटामिन डी है, जिससे किडनी स्टोन्स होने का डर रहता है, जिसकी साइड इफेक्ट ज्यादा होती है, वो नहीं लेने का. जो सस्ती वाली कैल्शियम है, सिंपल कैल्शियम कार्बोनेट टैबलेट्स और इवन कैल्शियम साइट्रेट, जिनको कैल्शियम कार्बोनेट से गैस बनती है, वो कैल्शियम साइट्रेट ले, उससे गैस नहीं बनती. तो दे आर चीपर ऑल्सो, दे आर गुड एनफ टू इम्प्रूव बोन मिनरल डेंसिटी. अगर मुझे फिर भी ऑस्टियोपोरोसिस हो गया है तो सिर्फ कैल्शियम एंड विटामिन डी उचित से सफिशिएंट नहीं होगा, तो उसके साथ वी मे हैव टू टेक सम अदर मेडिकेशंस. देयर आर टैबलेट्स व्हिच कैन बी टेकन वीकली और मंथली. अगर बहुत सीवियर है तो देयर आर सर्टेन इंजेक्शंस आल्सो जो कि रात में बेड टाइम ली जाती है, जस्ट लाइक इंसुलिन, टोटली पेनलेस, पतली होती है, खुद लगाना होता है. और आजकल तो ऐसी भी इंजेक्शंस आई है व्हिच आर गिवन वंस इन 6 months, or even there's an annual injection treatment for osteoporosis. So बहुत सारी treatments है which are very easy to take, very well tolerated. So अपने endocrinologist से मिले, discuss your issues, your problems, your bone mineral density, and दोनों मिलके let's decide what's the best treatment. It's perfectly treatable and we can prevent future fractures.
Thank you, sir. So we have a lot of options for treatment of osteoporosis. It is not that अगर एक बार osteoporosis हो गया तो हम कुछ कर नहीं सकते, बहुत कुछ कर सकते हैं, डेफिनेटली. थैंक यू सर. बोन डिसऑर्डर्स आते ही ना सीधे ऑर्थोपेडिशियन की याद आती है. पीपल आर लाइक कि बोन डिसऑर्डर है तो ऑर्थोपेडिशियन के पास चलते हैं. सो व्हाई कंसल्ट एन एंडोक्रिनोलॉजिस्ट फॉर ऑस्टियोपोरोसिस? Sahana ma'am, I would like you to tell us that how do hormones affect our bones? Why should people go to endocrinologists rather than orthopedicians for treatment of osteoporosis?
Yeah, that's a very good question, because many of the patients often ask us, why am I referred here? and then the reference would be somewhere from the orthopedics itself. So then patients would be wondering why are they referring to a department which predominantly sees diabetes, thyroid, and other hormone problems. For this, we have to understand the disease per se, the osteoporosis, what we're talking about. It is metabolic bone disease. Here, when we talk about bone, we think it's a solid and a constant structure, but that's not true. Bone is a very dynamic tissue and it is constantly remodeling. We have phases of bone formation, jahan hatti banti hai, then you have bone resorptions, that there is a loss of some amount of bone, and this is constantly happening. And this process is influenced by a lot of things. Most important factors are the hormones, especially our sex hormones, which strongly influence this. And so they kind of control this remodeling process. So whenever there is hormonal imbalance, like there is sex hormone deficiency, like estrogen deficiency or testosterone deficiency, then this process of remodeling is altered. There's accelerated bone loss, and that is why our bones become weak. In addition to the several other hormonal problems, which is already mentioned, like thyroid disorders, or say steroid disorders, or somebody is on steroids, or you have some inflammatory diseases, arthritis, etc., or somebody is on some medications like steroids, anticonvulsants, etc. All these could affect this bone remodeling, and that is why there would be an accelerated bone loss, and that is why the bone would be porous and osteoporotic and prone for fracture. So when we talk about osteoporosis management, of course, it involves active screening, and of course, like Dr. Deep mentioned, calcium, vitamin D, and giving anabolic therapies. It also includes understanding the secondary causes, if there are any, screening for any secondary causes, and looking for the risk factors. And remember, this is a chronic metabolic disease. It is not like a flu or something where you do just a treatment for a short duration, patient is cured. It's a continuous process where you need continuous follow-up. And endocrinologists are the experts who are trained and who deal with this screening, understanding the overall aspect of bone health, where they look at if there are any risk factors, if there are any secondary causes, and also they would be better to know what is the therapy which would suit for that particular patient. Now, there are several different osteoporosis therapies. Depending on the patient profile, which suits best to the patients is offered, and then this is a continuous process which requires long follow-up. So this is an area which is predominantly managed by endocrinologists who are specialists in dealing metabolic bone diseases.
So
Although
can
we
say
would require orthopedicians when there is an osteoporotic fracture, of course, for a fractured acute care, we would require orthopedicians. But in subsequent osteoporosis management, even those who have fractured require osteoporosis therapy to prevent further fractures, and then the care should be with an endocrinologist.
Thank you, ma'am. So fracture का treatment तो orthopedician ही करेगा, but we can say that bone is an endocrine organ. You know, bone का सब कुछ काफी कुछ hormones पे depend करता है. There are so many secondary causes of osteoporosis which only an endocrinologist can think of, because we are hormone specialists. So even bone is an endocrine organ. So bone health, bone strength को कैसे maintain करना है, कैसे treat करना है osteoporosis, and all those things are best done with endocrinologists. So definitely consult an endocrinologist if referred by your physicians, or if you think you have osteoporosis. Moving on, Mittal sir, people think that osteoporosis even co-medicos think that osteoporosis investigations are needed only if there is a fracture. You know, people are commonly investigated after they sustain a fracture. So this myth has to be bursted some or the other days. So please tell us, when are osteoporosis investigations and what investigations are to be done?
Sir, you are muted, sir.
So you are muted.
जैसे मैंने पहले बताया आपको, ऑस्टियोपोरोसिस में कोई सिम्टम्स नहीं होते, कोई दर्द भी नहीं होता, बहुत बार कुछ तकलीफ नहीं होती, तो हम क्यों टेस्ट करें, ये वजह आप समझ गए हैं. अगर हम डायग्नोसिस ऑस्टियोपोरोसिस का नहीं बनाएंगे तो हमें तभी मालूम पड़ेगा जब फ्रैक्चर हो जाता है, इसलिए पहले टेस्ट करना जरूरी है, तभी तो हम फ्रैक्चर को रोक सकते हैं. सो व्हाट आर द टेस्ट दैट वी डू? द फर्स्ट एंड द मोस्ट इंपॉर्टेंट टेस्ट जो ऑस्टियोपोरोसिस के डायग्नोसिस में यूज होता है, फर्स्ट इज डूइंग अ bone density measurement. As I said, DXA, dual energy X-ray, these are now available in almost all large cities in fairly reasonable numbers, accessible to at least the urban population. Some patients may require a plain X-ray also at the same time, so you can have a plain X-ray of the spine along with the bone density. That's the starting point. But खाली वो नहीं होता कि हमने अब तो हमारा diagnosis हो गया, अब ने बोन डेंसिटी करा ली, हुक्का माई, अब दवाई लिखिए. तो जैसे अभी आप लोग बता रहे हैं, it's important that we look at other reasons. What is the reason for osteoporosis? Is it just straight postmenopausal or age-related osteoporosis? Is there a huge component of nutrition? Is there a huge component of some other contribution by some other disease? जैसे किसी में होता है कि वीट एलर्जी होती है, तो वो एब्जॉर्ब नहीं करते वीट, तो उसके साथ साथ वो बहुत सारी चीजें एब्जॉर्ब नहीं करते, इन्फ्लेमेशन हो जाता है हाथों का, तो दे डोंट एब्जॉर्ब, सो दे गेट डेफिशिएंट। ऐसा होगा तो फिर ऑस्टियोपोरोसिस जैसी बीमारियां होंगी ही। कुछ लोग ऐसी दवाइयां ले रहे होते हैं जैसे एपिलेप्सी की दवाइयां, उसमें भी ऐसे होता है। कुछ लोग टीबी की दवाई लेते हैं, उससे भी ऐसे होता है। तो ये सब चीजें देख के आपके डॉक्टर आपको बताएंगे कि आपको टेस्टिंग की जरूरत है कि नहीं। टेस्टिंग में एक्सरे और ये बोन डेंसिटी, उसके अलावा आपको ब्लड टेस्ट करने पड़ेंगे जिससे ये सारी बीमारियां पकड़ी जाएं। डायबिटीज इटसेल्फ इज अ रिस्क फैक्टर, शुगर के लिए टेस्ट होगा, थायराइड के लिए टेस्ट होगा, नॉर्मल कैल्शियम, फास्फोरस, कैल्शियम लेवल कैसा है। फिर एक विटामिन डी की बात हुई, विटामिन डी बहुत इंपॉर्टेंट है। विटामिन डी इज क्रिटिकल टू आवर बोन हेल्थ, and maintaining 25 hydroxy D levels of above 20 nanograms is very important for us, and for some high risk patients even 30 nanograms. तो ये सब चीजें जरूरी हैं आपको टेस्ट करने के लिए। किडनी फंक्शन टेस्ट करना, लिवर फंक्शन, ये लिस्ट लंबी लगती है, लेकिन आजकल जो लैब्स पैकेज करते हैं, पैकेजेस होते हैं बहुत सारे और काफी रीजनेबली प्राइस्ड भी हैं, उस अक्सर उन पैकेजेस में 80% टेस्ट तो एक ही बार में हो जाता है। उसके अलावा हो सकता है आपको यूरिन में कैल्शियम देखना हो या कोई अलग स्पेसिफिक टेस्ट हो, तो वो आपके डॉक्टर बताएंगे। लेकिन एक बार जब हमारा डायग्नोसिस हो गया बोन डेंसिटी कम है, इसके माने ये पक्का नहीं है तभी भी कि हमें इलाज कराना है, दवा चलनी है कि नहीं चलनी है। कई बार बोन डेंसिटी उतना कम नहीं होती, तभी भी और रिस्क फैक्टर ज्यादा होते हैं। फैमिली हिस्ट्री होती है, कोई बहुत फ्रेल होता है, किसी को और कंडीशन साथ में होती है, किसी को स्टेरॉइड जैसी दवाइयां चल रही होती हैं जो कोविड में बहुत इस्तेमाल की गई, तो आपको ट्रीट करना पड़ता है। कुछ लोग को बहुत यंग है और थोड़ा सा लो बोन डेंसिटी आ गया तो फ्रैक्चर रिस्क लो होता है, तो उस टाइम पे नहीं ट्रीट करते हैं। तो ये एक पैनल ऑफ इन्वेस्टिगेशन होता है जो कि which follows a bone density. Sometimes it is along with that, sometimes it follows, but without these tests you cannot determine the cause, and therefore proper treatment can only be decided. It's not a complex thing. It sounds very big when I explain it like a long list. It's just one bone density which is available everywhere, maybe an X-ray and routine blood test. Go to your doctor. Maybe then you require specific blood tests like a bone turnover marker, etc., which your doctor will advise and decide treatment. So the treatment is prevention and treatment in osteoporosis is same. What is treatment? What are we treating? We are treating a low bone density so that we can prevent fracture. So you're preventing fracture and you're treating low bone density. Again, I will use the analogy. We are treating high blood pressure to prevent a stroke. So treatment bhi hai, prevention bhi hai. So same thing happens here. The same formula works. You treat, find the low bone density, look at risk factors, doctors will decide, and then take proper treatment so that you can protect yourself from a fracture. Don't wait for a fracture to happen. The only one point I'll make here is that sometimes just a backache in those who are prone can be a sign of vertebral fracture. Fracture sounds very big. Vertebral fracture is not like going into pieces like that. It's not like a forearm fracture, where it just breaks. In vertebral fracture, there is just compression. So the bone gets compressed. So it's not like a clean, not like the way we think of fractures in long bones. When you see the X-ray, you find that the bone, the front part or the back part of our spinal bone, which are like this. So some part gets compressed here or here. There is a pressure that your doctor again will see. And therefore, many people may have vertebral fractures with minimal or even no symptoms. That is why I always say कि एक बैक का एक्सरे भी करा लेना चाहिए। तो अगर कोई वर्टिब्रल फ्रैक्चर हुआ होता है जिसको कंप्रेशन, वो तो पेशेंट तो बोलेंगे फ्रैक्चर नहीं, फ्रैक्चर हमको नहीं है, फ्रैक्चर कभी हुआ ही नहीं, सिर्फ एक बार बैक एक हुआ था, I was cleaning my back with a towel and I got a sudden spasm, those kind of things. So इसलिए टेस्ट करना फ्रैक्चर होने के पहले जरूरी है। और फ्रैक्चर का रिस्क कई बार, क्योंकि स्पेशली वर्टिब्रे में, देखो हिप और हाथ पैरों का फ्रैक्चर तो पता लग जाएगा, बट वर्टिब्रे में, स्पाइन में फ्रैक्चर्स टिपिकल फ्रैक्चर की तरह नहीं होते, और सिर्फ वो फ्रैक्चर ही टेस्ट पे मालूम पड़ता है, पेशेंट को पता ही नहीं होता कि फ्रैक्चर हुआ है।
राइट सर, तो ये तो हमने बता दिया कि कैसे और क्या करना है, बट हम बार बार यही बोल रहे हैं कि ऑस्टियोपोरोसिस से कोई लक्षण नहीं होते, सिम्टम्स नहीं होते, तो साइलेंट डिजीज। तो पेशेंट्स को कब करवाना है ऑस्टियोपोरोसिस का इन्वेस्टिगेशन?
यू आस्किंग मी?
Yeah, Mr. Sir, yeah, just to add on to your
Yeah, sure, sorry. So of course, post-menopausal women, which means all women over 60 should be screened. Those beyond menopause and below 60 should be screened if they have additional risk factors. मतलब अगर आपके फैमिली में अर्ली कुछ हिप फ्रैक्चर की हिस्ट्री है, मदर को ही फ्रैक्चर था, ग्रैंड मदर को, वो तो आपको जल्दी टेस्ट करना चाहिए। अगर आपका थायराइड की दवाई आप खा रहे हैं हमेशा से, अगर आप स्टेरॉइड ले रहे हैं, ऐसे बहुत सारे कंडीशन है जिनमें और रिस्क फैक्टर होते हैं, उनको जल्दी स्क्रीन करना चाहिए, उनको 60 तक नहीं वेट करना चाहिए। इस तरह आदमियों के लिए 65 पे तो डेफिनेटली करना चाहिए, लेकिन शायद 60 पे करना चाहिए। इसमें एक जो बहुत कॉमन कंडीशन है, डॉक्टर दीप दत्ता ने मेंशन किया, दैट इज डायबिटीज। जिनको डायबिटीज होती है उनको भी जल्दी स्क्रीन करना चाहिए। अगर आपको 10 साल से ज्यादा डायबिटीज है और आप 50 ईयर्स से ऊपर हैं, तो आपको डेफिनेटली ऑस्टियोपोरोसिस के लिए टेस्ट करना चाहिए। फिर वही बात है कि उस बात का इंतजार ना करें कि जब फ्रैक्चर हो जाए। इसलिए इन सभी लोगों को, जैसे मैंने सारी कंडीशंस गिनाई, मेडिकल कंडीशंस, उन सब लोगों को जल्दी स्क्रीनिंग करना चाहिए। एवरेज हेल्थी नॉर्मल पॉपुलेशन, women at 60, men at 65 need to be screened.
Right. So we can easily remember that women after 60 and men after 65, even if you don't have any symptoms, please go and get yourself screened for osteoporosis. Thank you, sir. So moving on, Rana sir, हमें बताया विदीप सर ने कि बहुत सारे ट्रीटमेंट ऑप्शंस होते हैं ऑस्टियोपोरोसिस के, बट पेशेंट्स के दिमाग में एक ये मिथ है कि अगर हमें कोई सिम्टम ही नहीं है, कहीं दर्द नहीं है, कोई फ्रैक्चर नहीं है, तो हम इन दवाइयों को क्यों लें? Why should we get treated with so many medications when we have no symptoms at all?
Absolutely. That's a very common question that we face. In fact, I mean, if one doesn't have any symptom, or even if he or she had a fracture in the past, then also they think, I don't have any symptom right now. Why should I take medicines, or why should I take injections like this or oral medicines every week or so for so long? The reason being, just like the diseases like diabetes or high blood pressure, they are also most of those who are suffering from these conditions, they do not have any symptoms per se. A problem is that when the diabetes or hypertension is there, there is always a risk of conditions like stroke, like heart attacks, like damage to the eyes and other organs, so on and so forth. The same thing applies to the osteoporosis as well. With osteoporosis, as we have discussed over the last 30 minutes or so, that there is increased risk of fracture. And the fracture, of course, means pain. It means disability. It means, because, particularly the fracture, like fracture in hip, can make a person bedbound for a prolonged period of time and need for many surgeries with the replacement of the joint components, so on and so forth. So that comes with a huge burden of expenditure, as well as the loss of the time and all. Not only that, some fractures, particularly hip fracture, but others as well, are also associated with increased risk of death. As estimated that like a fracture of hip leads to death of around 20 to 30% of the individuals within 1 year. So that's a huge burden of disability, as well as huge risk of death. And all those things can occur even if there is no symptom to begin with. So to prevent all this, of course, we need to treat. And as others have already mentioned, that we have so many treatment options nowadays, and many of those are quite convenient. Like maybe injection once a week. Some injections can be taken by themselves, one in 6 months. Some tablets can be taken once a week. So the treatment is relatively simple, and the side effects are also very, very less. So it's always important to have a proper diagnosis and treatment of osteoporosis, even if one doesn't have any symptom whatsoever.
थैंक यू सर। तो जैसे कि हम इतनी देर से डिस्कस कर रहे हैं, जैसे हार्ट अटैक को रोकने के लिए हमें कोलेस्ट्रॉल और ब्लड प्रेशर को ट्रीट करने की ज़रूरत होती है, उसी तरह से टू प्रिवेंट अ फ्रैक्चर इट इज़ एसेंशियल कि हम ऑस्टियोपोरोसिस को ट्रीट करें, क्योंकि भले ही हमें आज कोई लक्षण नहीं हो, पर जब इसका लक्षण आएगा तो वो हमारी ज़िंदगी के लिए खतरनाक होता है, हमारे लाइफ स्पैन को कम करता है और डिसेबिलिटी को इंक्रीज करता है। और एक ये कॉमन कंडीशन है, ऐसा नहीं है कि मुझे नहीं हो सकता, ये किसी को भी हो सकता है। फाइन, थैंक यू सर। दीप सर, आई वांट यू टू नो कि हम बार बार बोल रहे हैं कि एडिक्वेट अमाउंट ऑफ कैल्शियम और विटामिन डी जरूरी है टू फॉर मेंटेनिंग गुड बोन हेल्थ, टू अचीव पीक बोन मास। तो क्या हर किसी को कैल्शियम और विटामिन डी खाना चाहिए, या किसको खाना चाहिए और कितना खाना चाहिए?
ये बिल्कुल सही सवाल है ये। और मेडिकल साइंस में कहना कि सबको सब कुछ करना है वो काफी डेंजरस स्टेटमेंट हो जाता है। बट हाँ, जिसको रिस्क फैक्टर है, अगर जैसे इतनी सारी हमने कंडीशंस डिस्कस करी, इनमें कोई भी एक कंडीशन है तो उचित है कि वो कैल्शियम और विटामिन डी ले। जैसे मैंने थोड़ी देर पहले कहा कि कैल्शियम मतलब कैल्शियम कार्बोनेट प्लेन होता है या कैल्शियम साइट्रेट, और कोई कैल्शियम ना ले। विटामिन डी मतलब प्लेन विटामिन डी कोलिकैल्सिफेरॉल ले, गलती से भी कैल्सिट्रायोल वाली विटामिन डी ना ले। और विटामिन डी भी लेने का तरीका, इंजेक्शन से मिलती है, गोलियां मिलती है। प्लीज टेक वीकली कैप्सूल्स और सैशेज और लिक्विड्स, नेवर टेक इंजेक्शंस, दे आर ऑब्सोलीट। जो 6 लाख वाली इंजेक्शन होती है वो आउटडेटेड हो चुकी है। देखा गया वो लगाने से भी स्टोन्स होने का रिस्क होता है। ओरल विटामिन डी सप्लीमेंट बिल्कुल सेफ है। तो रही बात किन को लेना चाहिए, आई थिंक मोस्ट कॉमन कॉज है कि एक नॉर्मल कंडीशन जो है पोस्टपार्टम महिला, गर्भवती महिला आफ्टर डिलीवरी, दे डिजर्व कैल्शियम एंड विटामिन डी सप्लीमेंटेशन फॉर 1 to 2 years एटलीस्ट, ताकि आगे जाके मेनोपॉज के बाद ऑस्टियोपोरोसिस ना हो, बिकॉज दे नीड टू रिप्लेनिश उनकी जो हड्डियों से जो कैल्शियम जा चुकी है बिकॉज ऑफ द चाइल्ड बर्थ, दे नीड टू रिप्लेनिश अपनी हड्डियों में जो कैल्शियम कमी है उसकी पूर्ति करनी है, उनको लेना है। बाकी कोई भी कंडीशन है जो कि स्टेरॉइड्स या कोई भी हाइपरथायरॉइड कंडीशन जिसके कारण हड्डियों की लॉस हो सकती है, उन्हें लेना चाहिए। बट ये कहना कि सबको कैल्शियम और विटामिन डी खिला दो, ये उचित नहीं होगा।
क्या सारी पोस्ट मेनोपॉजल वुमेन ने लेना चाहिए?
सारी पोस्ट मेनोपॉजल वुमेन में कैल्शियम विटामिन डी रूटीनली रिकमेंडेड नहीं है। गाइडलाइंस ने नहीं कहा कि सबको खिला दो तो फर्क पड़ेगा भी क्या। तो जो हाई रिस्क फैक्टर्स है उनको दे। हाँ जरूर, अर्बन, जैसे सर ने कहा, मित्तल सर ने कहा कि जो शहरों में रहते हैं, धूप में नहीं जाते हैं, जैसे मोर देन 90% प्रेवलेंस है विटामिन डी डिफिशियंसी। तो जिनकी डेफिशिएंसी हो, विटामिन डी चेक कराए और रिकमेंडेड डोज में विटामिन डी ले विद कैल्शियम सप्लीमेंटेशन फॉर द ड्यूरेशन ऑफ विटामिन डी थेरेपी। ये नहीं कि हम सालों साल तक लेते रहे, ऐसा उचित नहीं होगा।
अगर हमारे डाइट में कैल्शियम पूरा नहीं होता और अगर हम मोस्टली इंडोर्स रहते हैं, तो डेफिनेटली हमें कैल्शियम और विटामिन डी सप्लीमेंटेशन लेना चाहिए,
बिल्कुल।
स्पेशली द पोस्ट मेनोपॉजल एंड पोस्ट प्रेग्नेंट वुमेन।
जी
Right.
बिल्कुल।
Thank you, sir. Sahana ma'am, you know, people with diabetes commonly come to us. There's so many people we are looking every day who have diabetes. So when I suggest my diabetics कि please get screened yourself for osteoporosis, they are like, what? मेरे को शुगर की बीमारी है और मुझे हड्डियों की जांच कराने के लिए क्यों बोल रहे हैं? मुझे तो ऐसा कोई लक्षण नहीं है। So you know how to break this myth? What to tell patients कि अगर आपको डायबिटीज है तो osteoporosis क्यों हो सकता है? Why should they get screened for osteoporosis?
Yeah, I think that makes sense, because most of our patients would be thinking, why are we asking for that test? So the simple thing we can start with is, we know most of our patients would know that diabetes affects eyes, nerves, heart, etc. So it also affects the bones. This is what I start with. I tell them that diabetes is one disease which can affect most of our body organs, and people with diabetes are at increased risk of sustaining fractures. So diabetes comes as one of the important risk factors, and just like Mithil sir mentioned, somebody who has diabetes of more than 10 years, they are definitely and are in the age group who are at a high risk of osteoporosis. These patients definitely need screening and treatment for osteoporosis. Now, what happens in diabetes is that both the quality and the quantity of the bone is affected. During hyperglycemia, the release of certain molecules which affects the bone formation, and also there is some amount of increased bone resorptions. So this leads to poor quality. This leads to the decreased bone density. In addition to it, the quality of the bone is also compromised. So this makes the bone weak and more susceptible to fracture. addition, patients with diabetes also have high risk of falls, because some of these patients, especially those with long-standing diabetes, may be having neuropathy, maybe having an imbalance during walking, or the gait may not be stable, which might be a risk factor for fall. They might also have visual problems because of the retinopathy. Some of them could have postural hypertension. So all these are risk factors for fall, and we know that that's an important, again, risk factor for fracture. So it's very, very important that patients with diabetes are made aware that they are at risk of osteoporosis, and also that why we are treating for osteoporosis, because we want to prevent fracture, which has associated high morbidity and mortality, like we discussed previously, that especially when there's a hip fracture, the mortality is as high as for 20% following the first year of the fracture. So once we explain that, probably patients would understand. So I always tell them, not in the same time, I tell next time when you're coming, you also get your the next follow-up, also get your bone BMD assessment done, and then we also do a risk stratifications, and treating them would definitely help in preventing fractures.
थैंक यू मैम। सो जैसे कि सभी जानते हैं कि शुगर के पेशेंट्स में कोविड ज़्यादा सीवियर होता था, सिमिलरली शुगर के पेशेंट्स में ऑस्टियोपोरोसिस अर्लियर एज में होता है, एंड इवन फ्रैक्चर रिस्क भी ज़्यादा होता है। सो व्हेन यू आर एडवाइज्ड टू गेट चेक yourself for osteoporosis, so please do get screened. We had a very nice discussion. So before we close, I would like to request my panelists. So Amrish Mittal sir, will you please give a takeaway message for the patients? A simple takeaway message after today's discussion.
You are muted, sir.
So you're muted.
Sorry. I think one point that we haven't discussed, and I think which is a very important message, should be a very important message, is the fact that osteoporosis, the tendency for osteoporosis starts in childhood. So osteoporosis is thought to be a pediatric disease with geriatric manifestation. इसका मतलब क्या हुआ कि हमें अपनी हड्डियों को मजबूत, अपने बच्चों की हड्डियों को मजबूत करना है उनके ग्रोइंग एज में। हमें इंतजार नहीं करना है कि जब वो 50 साल के हो जाएं तो उसके बाद उनकी हड्डियां सब कमजोर होने लग जाएं, फिर हम टेस्ट कर रहे हैं वो तो शायद करेंगे, लेकिन अगर हमें उन्हें बचाना है तो जैसे उनके नॉर्मल सर्विस टाइम में हम बोलते हैं कि आप अपना बैंक बैलेंस बनाइए, इसे रिटायरमेंट के बाद आप अच्छे से रह सकें, इसी तरह आपको बोन बैलेंस बनाना होता है। तो अगर बच्चे ग्रोइंग एज में, स्पेशली 12 to 18, एक रफ एज बता रहा हूँ, 12 to 18 जहां हड्डी में कैल्शियम बहुत तेजी से जाता है, उस समय अगर हम बच्चों को सही मात्रा में दूध, दही, मतलब डेयरी प्रोडक्ट्स, फोर्टिफाइड भी आ रहे हैं अब तो, फोर्टिफाइड विद विटामिन डी ऐसे प्रोडक्ट्स, और धूप में खेलने की सलाह दें, और अगर धूप ना हो पाए तो स्मॉल डोजेस ऑफ विटामिन डी, डॉक्टर दत्ता ने जैसे एम्फसाइज किया, वो भी दें। तो जब हड्डियां बन रही होती हैं, when the bones are forming, that time is a time to put in as much as you can. जितना जमा करोगे वो लॉन्ग टर्म फायदा देगा, लाइक एन इंश्योरेंस पॉलिसी। तो उस तरह से, इसलिए आप उस बात का, बीमारी का इंतजार ना करें। अगर ऑस्टियोपोरोसिस का प्रिवेंशन करना है, ऑस्टियोपोरोसिस से बचाव करना है, फ्रैक्चर से बचना है, तो ग्रोइंग एज के बच्चों में सही जरूरी है, जिससे कि उनकी बोन डेंसिटी अच्छी तरह डेवलप हो सके और वो आगे जाके उनकी हड्डियां कमजोर ना हो। एक लाइन इसमें और है, ये मैंने ग्रोइंग एज के बच्चों के लिए बोला, लेकिन ये एक्चुअली शुरू होता है प्रेग्नेंट लेडीज से। प्रेगनेंसी में भी अगर माएं सही न्यूट्रिशन लेंगी तो उनके बच्चों की हड्डियां बेटर होंगी। तो थ्रू आउट अगर कैल्शियम, प्रोटीन और विटामिन डी का हम ख्याल करें तो जो एक इतना बड़ा बर्डन ऑस्टियोपोरोसिस का इंडिविजुअल पे, फैमिली पे, सोसाइटी पे और देश पे, सभी पे आने वाला है, वो हम उसको काफी हद तक रोक सकते हैं। सो ऑस्टियोपोरोसिस प्रिवेंशन बिगिंस इन चाइल्डहुड।
Thank you, sir. There can be no better way to summarize it. Rana sir, please give our people who have joined us some take-home message.
Right. It's always ideal to prevent the first fracture, as Dr. Mittal said. But even if that's not possible, even if one fracture occurs with relatively less kind of impact or trauma, like fall while walking or running, etc., always get yourself tested for the additional causes, some causes of osteoporosis, and you should treat yourself appropriately. Otherwise, it can lead to subsequent fractures, which will increase the chance of various disabilities and even, unfortunately, death.
थैंक यू सर. ऑस्टियोपोरोसिस एक बीमारी है जिसके लिए हमें डेफिनेटली स्क्रीन करना चाहिए क्योंकि हम इसे इजीली ट्रीट कर सकते हैं. दीप सर, कैन यू प्लीज गिव आवर व्यूअर्स सम टेक होम मैसेज?
मेरा एक ही मैसेज है कि घर में ना बैठे, धूप में जाए, गो आउट इनटू द सन, और मिड डे धूप में जाए, सुबह 10 से लेके 2 या 3 बजे की जो धूप है उसमें जाए. और कॉकेशियंस गोरे लोगों को तो 10 मिनट धूप से काम चल जाती है, उतना ही विटामिन डी बनाने में हमें 20 मिनट लगते हैं, 20-25 मिनट तो कम. और सनस्क्रीन लगा के मत जाए, जितना पॉसिबल हो अपने बॉडी पार्ट्स को एक्सपोज करें. रोज अगर हम 15-20 मिनट मिड डे धूप लगाएंगे तो काफी हद तक हमारी स्किन विटामिन डी बना सकती है. घर से बाहर निकले, दैट्स द ओनली मैसेज.
Thank you, sir. Sahana ma'am, please give your remarks, and especially I want you to know there are many comments. People want to know what should they do to prevent osteoporosis, especially women, because they tend to ignore their health. Elderly women. So a simple message for them: what they can do to prevent osteoporosis.
Yeah. So I think what we should understand is that for elderly, bone health is like independence. So if there's a fracture, then they're totally dependent for their day-to-day life. So it's very important to stress upon bone health in elderly women. Now, it's first of all, like like mentioned by everybody in the panel, it is important to first of all promote a good bone health by promoting a good peak bone mass, and this must start from childhood, especially in girls, where we ensure that they take adequate calcium, protein also, because that's also very important in bone health, and vitamin D. And also we encourage them to be physically active, because that's again, like mentioned, very very important to achieve a peak bone mass. And then we are concerned in the middle age about the bone loss, right? So there again, the same factors of having a optimum protein, calcium, vitamin D, and exercising plays an important role. In addition to that, this is an age group where you can have diseases or medications which could affect your bone health. So bone health must always be there in our mind when we're dealing with any diseases, and we must take bone protective measures if it is a condition or a medication which is going to affect the bone health. And then when it comes to an elderly age group, the focus must be on active screening, identifying those with a high risk of fracture or osteoporosis, and offering them therapies. So this would definitely improve the bone health to begin with, and then prevent fractures in the later age group.
Thank you, ma'am. Thank you so much. So osteoporosis can easily be prevented and treated. ये एक ऐसी बीमारी है जिसके रूट्स बचपन से शुरू हो जाते हैं, तो हमें ध्यान रखना है कि हम adequate bone mass को achieve करें, which is through adequate amount of calcium and vitamin D intake during adolescence, during pregnancy and young years, especially before 30 years of age. और उसके बाद हमारे लिए बहुत ज़रूरी है कि हम throughout physically active रहें, because strong muscles and strong bones के लिए physical activity, exercise, yoga, everything is very important. So I would like to thank all my panelists for such wonderful information, for increasing our knowledge level today. I am definitely sure our viewers must have gained a lot today. So thank you, Mittal sir, thank you, Rana sir, thank you, Deep sir, thank you, Sahana ma'am. Also, I thank Endocrine Society of India for organizing this session. All the viewers, whoever has more questions which we could not take up right now, you can definitely write them in the comments. We'll reply back to you. Thank you for being a part of this session, and wishing you all a very happy Diwali. Just to remember that we have to step up for our bone health. Thank you so much. Thank you, everyone.
Thank you, Nancy. Thank you.